Yeah, I'm graduating this month with my Bachelor's of Science in Nursing from and how I got into nursing was in high school, I was able to shadow a few nurses through my high school medical program, which I really liked, like the day-to-day work of it. But what really got me inspired was some of my family. We just run the hospital for different things. And I felt like the nurses in the hospital really stood beside my family and they turned what could have been something really scary and traumatic into a very positive experience. And just after these experiences with these nurses, I realized that nurses, they have the ability to really care for and really change the experience of a family, and they have such a great impact on care. And I realized that I the kind of nurse that these nurses were for my family. Alongside of doing all this stuff, I was also tutoring and nannying, babysitting, working with kids in different capacities. And then going into college, I was lucky enough to work in a nursery at a local daycare. And this experience made me realize I really love working in a team with other team members. And I also just love working with babies, and I want to work in pediatrics in some capacity. And then finally, I was able to do my capstone here in the NICU, and this was just an amazing experience. It really ignited my passion for NICU nursing and wanting to serve the pediatric population. And the nurses on the floor really inspired me with their care and skill, causing me to want to apply here.
I graduated from accelerated BSN program at I am licensed RN, and I am also an International Board of Certified Lactation Consultant, IBCLC. I also obtained a certificate called Breastfeeding NICU Infants, and I have NRP and stable certification as well. I am volunteering at, which is a pediatric palliative home, and I had my senior preceptorship at NICU, and I had the pediatric rotation at. Oh, should I talk about that?
Yeah.
Okay.
Yeah, that's
I had
great.
a pediatric rotation at, and honestly, I felt like I belonged there. One of the biggest things, of course, the magnet certified practice, implemented very beautifully in the unit. And also the other thing I was really impressed with was the communication tools, the PCares. It was very well utilized by everybody in the medical staff team, including, child life, the music therapist. Everybody was great at communicating to the patients and families. So that was something I was really inspired. And that's one of the reasons I really would love to work for. And NICU it's always my passion, to support the family at the beginning of their life. So that's why I apply for this position.
Awesome. Love that.
If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel. If you use the discount code YouTube, it's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube.
I know it's kind of cheesy, but I like to say that nursing chose me because there was never one moment in my life where I kind of was like, I'm going into nursing. I always knew from the very beginning that I was going to nursing. I was like I had my blinders on. I was going straight for nursing. My grandma was a nurse for 50 years and my mom worked in women's health. So I was always surrounded by that. And I've always been intrigued to help care for things, and even like little animals that I know probably didn't need my help. But I've always had that sense of nurturing and to giving like parts of myself to things that need help. So I've always felt that calling. Yeah. And then, so straight out of high school, I got my CNA and I worked in a nursing home, and that definitely solidified my choice in the nursing field because of the fulfillment I felt every time I was at work. And every time that I was able to see the difference in my patient's attitude by just walking into the room and them knowing that I was going to be their CNA for the day, they felt safe and that they were going to be taken care of, So that definitely solidified that choice. And then I also was a medical assistant at an urgent care clinic, which was really useful for me because I was able to understand how a unit, like a clinic, functions and how to prioritize my tasks in a way to where it benefits everybody else and the whole clinic flows smoothly. So yeah, and then I just graduated in June and I got my license in August, and I am halfway through my bachelor's program. And I'm really excited to just get started in my career.
I don't want to scare you, but that's often like a red flag. Some of them have a weird hang up of, no, our program's really hard. You can't do your program and school. So it's not unlikely that they will ask questions about that. If they do, don't be thrown off. It doesn't necessarily mean like they're not going to pick you, as long as you have a really good answer of why it is that you think you can do school and a new grad program. So you're halfway through. So when would you finish?
Probably January. Right now, that's because I'm taking 2 classes because I'm not working. So, but it's online. It's really easy. It's just busy work, and I can fly through that. I'm really good at multitasking and kind of prioritizing my time.
So instead of saying you're halfway through, it might be better to say you have just a few months left.
Okay.
And you could even say that the few months left are mostly just sort of busy work type of, or maybe you could say like, I want to be fully transparent about how I do have a few months left of my bachelor's program before I'm officially done. All that's left currently is just sort of assignment and busy work. I've already gotten my license, because that'll kind of put the kibosh on their worry of, well, she needs to focus on school and our new grad program, it's just going to be too hard. Like nobody can do that.
Okay.
Yeah.
Okay.
Yeah.
To not let them. Okay.
Yeah. I would be surprised if they didn't ask you about it, actually. Yeah. Sorry. So keep going with that. So you got your license, and you just finished with the community college and working on the bachelor's.
And I'm just really excited to be able to start my career, and hopefully be able to start my career here at such a reputable hospital.
They will probably start by saying, can you tell us a little bit about yourself?
I just graduated from with my BSN degree, and I also passed the NCLEX on October 2022. And before nursing, I did some work experience as a registered dental assistant in a pediatric and adult dental clinic. And I also did some volunteer experience in a senior residence facility. And also, I did my senior preceptorship at emergency department. So what I love about is that first, they're a magnet hospital, which means to me that they are very high on nursing excellence and high quality patient care. And I personally witnessed the work culture inside the healthcare team. They're very welcoming, they celebrate diversity, and they're very dedicated and committed on providing best patient care for all the patients, regardless of who they are. And why surgical nursing? Because I have an experience when my family members has been in the hospital after their heart surgery, and I experienced there how warm and how very comforting those nurses. And one time I also had my my granddad who passed away, and I experienced the warmth and the comfort of the nurse had given me. Even though I wasn't the patient, I felt very supported, and I felt that I wasn't alone. So that's what really makes me pursue my nursing career. Thank you.
I love it. I think some extra things. So the way you worded it was perfect. You can add, because you were saying they provide the best quality care. You can say the best quality evidence-based care.
Definitely.
Because they are so into evidence-based practice, they ask a specific question about it later. So if you can put that word in the beginning, they'll be like, oh, she knows what's up. They also ask a question sometimes about family-centered care. So if you can throw that word about how you really respect their emphasis on family-centered care, and you were able to experience that when you had your friend's dad in the hospital, that kind of thing, put in the words evidence-based care and then family-centered care. And they'll be like, oh, she speaks our language. She knows. She's ready to go. I think that's actually really good. Most people really struggle with that question. I think that was perfect.
I'm from
I recently just graduated the nursing program this December. What really got me into nursing was I particularly was a patient at one point when I was a child, and I used to have a really big fear of hospitals and medical procedures until there was this one nurse who really sat down with me, explained the whole procedure of getting my blood drawn, and she was very warm and compassionate with me. And that's something that really made me feel not so scared. And that is the care that I really intend to replicate in my future nursing practice. I recently just finished my emergency department preceptorship this semester, and I knew that this was my place because each and every day I came in so excited, and at the end of my first day, I literally did not want to leave. I just loved the atmosphere. I loved the rapidly changing scenarios, and I just love exposing myself to all different types of diverse situations. And that is something I found myself really able to do in the emergency department. And I don't know like what else to say because
So you could, for each interview, like right, you would go on Google nursing careers hospital or something and see what they pride themselves on and what their mission statement is and pick like one thing that doesn't sound like you're rattling off their mission statement, but something where it seems like this is the place that you want to work at and you know a little bit about it and like you're being intentional of where you're applying or whatever. Another thing you could do is, I don't know if you ever did any like direct patient care jobs of like nursing assistant or like phlebotomist or medical assistant or anything like that you could talk about.
So that's like another one of my issues is that I don't have like a background in CNA experience. The only thing I did was I was a volunteer for the American Red Cross blood donations. So
Okay.
the blood donor ambassador. So I went to different locations around area and I helped them with their donation process and what donation types best suited for their blood type, like Power Red, the whole process. And then after I monitored them to make sure they were fine, like with the
Okay.
snap.
Did you actually draw their blood?
No.
No, okay.
Checking in them and screening them and then assisting with different blood types, paperwork, and then helping them after the donation.
Okay. Monitoring. I like the monitoring part because that sounds nursey. Yeah, you could talk about that. When did you do that before school?
Yeah, I did that before I went into nursing.
Yeah, you could mention it briefly that while you were doing your prerequisites or whatever, you did this volunteer experience just to get more experience hands-on with patients. Yeah, overall, it's really good. It hits everything that you need to hit, but it's also kind of different in a way. Like it felt not too coached sounding, which I like. I don't want to like mess it up.
I have one more question. So
Yeah.
if I'm applying to all these emergency department positions, should I mainly take my experiences from my emergency department preceptorship and use those in my answers because that just makes me sound more like in the unit and like what the unit's about, or should I take it from all of my experience?
It
Like,
would be best to have the bulk of it be from the ER. That way they can kind of picture you working with their patients.
okay.
Yeah. And they know that you actually know what it's like and you're not just liking the idea of it, you know?
Yeah. Okay.
Yeah.
I knew that I wanted to be a nurse ever since I was little. My older sister actually got bacterial meningitis when she was about 10 years old, and I was 8 at the time. And so she was in the hospital for over 10 days. And so being alongside her in the hospital setting and seeing how the nurses cared for her, and not only for her, but for our whole family, was really impactful even as a little girl, and just made me really want to do that for others. So from that experience, I knew at that time, even as a young girl, that that's what I wanted to go into, and I wanted to be a nurse and be able to provide that care for other people. Moving forward, I went for nursing school and really loved my nursing school experience, but unfortunately it was a little bit different than your typical nursing school experience because all of it but the first semester was heavily impacted by COVID. And so unfortunately, after that first semester, the school had to cut down on clinicals, and some moved online, and some were just taken away completely due to safety concerns. And so the clinicals that I did have, I really loved, but unfortunately just didn't get a ton of that experience. And so then I graduated in 2021. And after graduating, I just didn't feel super confident. I didn't know if I was ready to go into a hospital type situation just because of the nature of clinicals. So I ended up working at a high school, and I really enjoyed working with that population and working with the kids. So had a really good experience with that. And then moving into the summer, I was a nursing supervisor at a summer camp in Yosemite. So again, got to work with the pediatric population, which I really enjoyed. Then after the summer camp, another thing that I have always been passionate about is gymnastics. Grew up doing gymnastics, and so I had the opportunity to coach 2 different gymnastics teams. So I did that, and then just kind of all of my experiences combined and reflecting on my time since graduating, I just realized that I really do want to transition into like a more acute care hospital setting. And so, but with that kind of lack of confidence, I decided to enroll in a RN refresher course because I just really wanted to go into any role that I got in the hospital confident in my skills and in my knowledge. And so I have been taking that course, and
What are you excited for? What are you looking for?
yes, and I'm really excited coming like now on the backside of that, coming out of that. I feel like I have gained a lot of skills and confidence in that. So I feel really good moving into a hospital type position. And I have always, really enjoyed working with pediatric populations. And one of the clinical rotations that I did get the opportunity to have during nursing school was the OB rotation. And I really loved that. I think that labor and delivery, I think it's a really unique specialty. I really like the dynamic and fast-paced nature of it. And I also think it's cool because it's, one of the biggest moments in someone's life and a big start of a new chapter for families. So I think that part of it is really cool.
Yeah, no, I think that's good.
So
A
that's
lot of people are in this boat, if that makes you feel better. Like
that
everyone
does.
thinks it's just them, but this is like your nursing generation. Clinical is just casually canceled. Just
Yeah.
what?
Yeah.
Yeah, so for sure.
That's good. That's good.
And then yeah, just say something that you like about the hospital. And then you could, I don't know if you can say it in a way that sounds humble, but you could talk about how you really liked the sort of educator role that you were able to do as the school nurse working with parents, and same thing at the camp as the supervisor. You were able to, I don't know, something about, because it makes you sound boss. That's what I want you to say. Makes you sound like a grown-up. I don't know if you can like casually slip in there like how much you liked kind of like the education of like patients and their families, like as like the opportunity for that the school nurse role gave you.
But I tie that in and be like, I really liked that part of working as a school nurse. And I know that working in labor and delivery, they're like new parents. And so education is a big thing.
Yeah.
Type of thing? Or no?
Yeah. And you can tie, yeah, you can use the thing with your sister to tie back how you really enjoyed this, but it wasn't quite what you went into nursing for. You're really being called to the bedside, so you did the RN refresher course to really make that happen for yourself. And that now you feel like it's time, you feel like you're ready, you feel like, you want to get your hands in on the front lines and really do what you've always wanted to do? And
Yeah, absolutely. Happy to. So I am a new graduate registered nurse. I just graduated last month with a bachelor's of science in nursing. It was an accelerated program. In my final term of nursing school, I was in the CVICU for my practicum. I spent 300 hours there, and that's where I really found my passion for caring for heart surgery patients. Before nursing school, I did a 1-year internship at Genentech for future healthcare professionals. And this really helped me learn a lot about the business side of healthcare and what patients can do when they can't afford costly medications. So that was a really eye-opening experience for me. And I did that during my gap year between my degrees. My first degree is in human physiology and in this degree, I learned a lot about evidence-based teaching. I was a teaching assistant, and that's something I'm really passionate about. And then, yeah, other than that, like moving forward in my career, I'm really excited to be in, and I can't wait to start my nursing career here, and I hope it's in the CVICU.
can you say a little bit, like add a piece in about like, how did you end up going into nursing specifically? Like, I know you kind of had like a healthcare background, but like what solidified like nursing?
Yes, absolutely. Yeah. So, when I was in my human physiology degree, I looked into a couple of different healthcare professions, and I shadowed a gynecologic oncologist. And it was really interesting the work that he did. But honestly, the takeaway that I got from my experience opportunities that are available in nursing. I met a nurse practitioner who was assisting him in the operating room, and I didn't know that nurse practitioners could do that. And then I also spoke with an RN in his clinic who was an oncology nurse and did the same degree that I did at U of O. And I don't know, I come from a family of accountants, and so I didn't have a really deep understanding of what nurses did. And this was kind of for the first time I saw, I didn't know of any other health profession that had just so much opportunity, kind of both laterally and just terms of you can do any specialty and also advance your degree. And I just thought that was so cool. And then in my nursing school practicum, just working with the CVICU nurses, seeing their level of autonomy and critical thinking, I really looked up to the nurses there, and those qualities are something I want to emulate in my nursing practice.